Alrighty, so we're just trying to decide between a food allergy and a food intolerance. As I was saying, even the medical community right now is having a hard time defining the two and deciding what they mean. Because like I was saying, a food intolerance is relatively new, probably because of all the funky stuff that is going into our food right now when it wasn't happening hundreds of years ago. So this chart kind of gives you an idea of how to divide up the food allergy and the food intolerance. They both fall under something called a food hypersensitivity, which is any adverse reaction to food. The food allergy, I don't know if I have a laser. Yes. The food allergy here, what they're saying is that it's immune mediated. So the immune system is what pushes this along, this problem along. And this chart, actually I don't completely agree with this chart, but I used it just to give you an idea and to understand a visual to understand the two. And I'll tell you why I don't agree with it. The food intolerance, they're saying, is not related to the immune system. And this is where I take issue. Because I think that the immune system does get involved, just in a different way. We're not going to go into all this because who cares? The chart was nice just to give you a visual, like I said, because I like those, and it just kind of, where you can file it in your brain and make sense of it. So we're going to talk about a food allergy first. The food allergy is an immune response triggered by a specific food. The response occurs usually within 2 hours of eating the food, if not almost always immediately. Someone with an allergy to peanuts, what happens right away? Very quickly, itchy mouth, itchy throat, swelling of the throat, depending on how severe the allergy is. So it usually doesn't take much longer than 2 hours for that symptom to appear. And they only have to have a small amount. The second and third bullet here, this one and this one, oh, this one too, but these ones were the ones we really care about. These are what's going to distinguish between a food allergy and a food intolerance. So the food allergy symptoms begin within 2 hours, and even a small amount can trigger that response. So the immune system that is involved in a food allergy is the IgE antibodies. So the immunoglobulin E. I remember this in school, IgE, allergy. So that makes it easy to remember if you're taking a biochem test. So this is kind of the process of food allergies. I didn't want to get too scientific, but I feel like knowing the background and kind of having that foundation can help you understand it and keep it in your head. So there's not, it's easier to remember. There is a diagram on the next page that's a little bit easier to follow, so I think we'll just go right to this. So we have the antigen. This is our body being exposed to the antigen. We're going to go this pathway here first, because this is our first exposure. Okay, we don't yet have the food allergy. This is our body's first time encountering what our body is now seeing as foreign and mounting and getting ready to mount the attack for future exposures. Okay? So the antigen comes into the body sees it as foreign. For whatever reason, that is still not completely understood. Is why someone's body would see a peanut as foreign and why mine doesn't. So the body, an antigen presenting cell, an APC, picks up that antigen, ingests it, and just like its name says, it presents it. So it's going to present it to a T helper cell, which is the white blood cell. The white blood cell being the biggies in our immune system, as we all know. So the T helper cell takes in that antigen. The sole purpose of that T helper cell, and I think the helper kind of lets you know what its job is. It doesn't really do all the work, but it's helping the system move along. It secretes some chemicals that tells the B cell, which is also a white blood cell, to make more of them, to multiply. Because what the B cell is going to do is going to make all of those IgEs. These are the antibodies. So now we've got the T cell telling B cells to multiply. We've got lots of B cells. This diagram is just showing one. And every B cell is spitting out tons of IgE. What the IgE does, which is once again the antibody, it is going to attach to a few white blood cells. One being a mast cell, which is on this diagram. Mast cell is probably the biggest when it comes to an immune response or an allergy response. But it's mast cells, basophils are also a white blood cell, macrophages are a white blood cell, that sort of thing. But the point here is This whole process has to happen the first time. And see, this is the IgE antibody here. Pretend this antigen isn't here right now. So the antibody is here. Now it's waiting. Of course, there's not just one. There's many. And so the next time the body is exposed to this antigen, now we're going to go this pathway. It goes right to the mast cell and attaches to the antibody. None of this needs to happen this time. For those of you that have developed food allergies later in life, maybe the first time you ate it, you got a little scratchy throat. Maybe the second time you ate it, you had a more difficult time breathing. That's kind of what happens. Because the body also keeps making more B cells and more IgE every time you eat it. Okay, so the second time and subsequent times, it happens more quickly. So this is about the second encounter. And what happens when that antigen comes onto the antibody and makes that complex, then with our body releases chemicals. The purpose of those chemicals is to get the antigen out. So you get the runny nose. You know, the blood vessels all dilate, everything gets runny. You can, well, I won't go there. So but the process is good. The body is smart. This is something I say in my practice all the time. The body is not stupid. Everything it does is, and you guys understand this, everything it does is for a specific purpose. It is not dumb. It wants to get rid of that antigen, so that's why we need to be runny and get it out in a respiratory type of response to an antigen. Some of the symptoms of food allergies. This is where we're a little bit different between allergies and intolerances. The anaphylaxis, the swollen throat, potential death will not happen with a food intolerance. It happens with a food allergy. The tingling and, the tingling and itching in the mouth. Some of these other ones, hives, swelling, wheezing, nasal congestion, abdominal pain, diarrhea, dizziness, lightheadedness, those could be food allergies or food intolerance symptoms, which you'll see. So here's food intolerance, also known as a food sensitivity. This right here is where the controversy remains. Is the immune system involved? Is it not? I say it is. I've seen a patient with IgG antibodies. These are more delayed situations. A food intolerance is also looked at as kind of like a lactose intolerance where you don't have a certain enzyme. The symptoms, here are the key differences. The symptoms of a food intolerance, which also make it hard to identify, is that they come on gradually and can be delayed for several days. Something I eat today may not bother me for 4 days down the road. Symptoms may also persist for hours or days after eating. So that also makes it difficult to really identify what is the problem. So a lot of us walk around with these situations and we don't know why. Why do I go from constipation to diarrhea? Why is my stomach kind of upset when I just had what I think is healthy? The other issue, which I have this issue here, is a cumulative effect. I can eat eggs. If I eat them 2 days in a row, might feel a little bit nauseous. If I eat them 3 days in a row, not a good situation. So I don't. With a cumulative type effect, what people can do, once you identify a situation like eggs for me, I eat them every 4 days if I want to. I don't eat them very often. Once in a while I'll eat them 2 days in a row and then I'll kind of regret it. So with that cumulative effect, you can do like a food rotation. Eating something that bothers you every 4 days or so seems to be a good situation. Some of the symptoms of food intolerance, a lot of the same ones. Here's some that are different though. The inability to lose weight. Pain. I've had patients go off foods that are a trigger for them and their pain decreases. Brain fog, because of the effect on the nervous system. I know when I eat sugar, I feel a little, actually when I went off sugar, and then one day I had it, and I didn't even have a lot, and I was off it for probably 3 weeks. I was doing a cleanse. I had a little bit of sugar. That night I felt like my head was lifting off. Just lightly, wasn't too hard, too bad. I didn't have a horrible headache, but I felt like it was detaching a little. And here's how we diagnose the two. Some of the things are the same. Obviously the patient history, talking about the symptoms and how they think food might be related. A diet diary is helpful for both. But what about food intolerance, did I just say with the diet diary might be challenging, is that If you eat something today, the symptoms don't show up for 3 days or so. That makes it more difficult. If it's a true food allergy, you will have it that exact day. An elimination diet is a way to do it. In the simplest of terms, what an elimination diet does is you go down to bare bones eating nothing allergenic, allergenic being something that would promote an allergy response, eating very plain foods until all symptoms are gone. And then you start introducing foods that might be that are more allergenic. So citrus can be, it's not a big one, so a lot of times people start with that, but then you have to wait a couple days. Do I have a response? If I don't, I'm good with citrus. Now let's try nuts. If I don't, I'm good with nuts. Now let's try sugar, that sort of thing. With the food allergy, because the body, we know and we trust that the body has an immune response with those IgE antibodies, you can do the skin tests. You can also do the blood test that will show the IgE antibodies to a specific food. So that's why food allergy is a little bit easier to diagnose. There's also a food challenge that you would do while in your doctor's office. Eat a peanut, let's wait and see what happens. You don't go anywhere, you don't do this at home, because then we can inject you with some epinephrine if we need to. The reason I became interested in nutrition, actually, I wanted to make sure I had enough time for this little story. The reason I became interested in nutrition was before going to chiropractic school, I did an elimination diet. I was having just low-level nausea, didn't know why. And so my mother and I did an elimination diet, went to very plain eating, and then we started introducing foods. First of all, when we went to very plain eating, probably about 7 days my symptoms were gone. No headaches, major decrease in pain, no stomach issues. I was amazed at how food can control pain, most specifically. I understood that it could have an effect on something going on in my GI tract, in my stomach. Everyone believes that because that's where the food goes. But that it could help with my pain and headaches was like blew my mind. So I knew I needed to learn more with nutrition. So that's the main reason that I did the Master's in Nutrition.
All right, we're going to stop right there.
Sure.